Kadri Akim Oluwaseyi, he's worried. He says, 65 government hospitals, that's good, but do we have doctors and other professionals to run all these centers?
Yes, at least the 65 hospitals have doctors. We have about the highest number. Okay, I hate to this comparison between states, but I think we have about the highest number of consultants in any state today, and about the highest number of doctors. Maybe one or two other states have about what we have. But it's not cheap, I must say that.
I was going to ask you this. We saw some young Nigerians who actually were outside the country before, but they're back home here, and
yes, we have a lot of. It's not cheap. It's just not cheap. Now we have the staffing. They may not be the adequate staffing because of the funding constraint. We still need more, as we are now. Even in our 65 hospitals, we still need more. But I must also emphasize that in terms of staffing, both for the general hospitals and that is for the doctors and the nurses, and even for the primary healthcare centers, the concept in managing health that even the DG of the World Health Organization is advocating, especially for developing countries, is to lay some emphasis on mobile health services. That is health services moving from place to place. In that way, you are able to cover a lot more places than when you have this stable or health services that are localized in the place, and people come from various places to assess it.
Well, one of the things that contributes to healthcare, you cannot, of course, overplay the role of the professionals in that particular sector. You've seen the recent crisis between different sectors is it a competition now between rivalry between different sectors of the health sector? How do you manage that within Delta State?
Well, first, it's unfortunate. What is happening is unfortunate. And 2 years ago, I actually discussed with the president of the Nigerian Medical Association on this competition and incessant strike in the health sector. And we agreed to hold a summit. We actually held a summit in Asaba. Brought a lot of health professionals. Some were not there, but generally we had a sizable number to discuss these issues. Now, what has happened? I don't want to confine myself to Delta states on this matter, because I think I've gone national in terms of trying to deal with competition, so-called, between healthcare workers. Now, I had the experience of being a patient going to the hospital. I also have the experience of being a doctor who had worked in the hospital. Now, from those two experiences, what I do know, or what I knew, was that at that time, everybody in the health sector knew his or her role. This also, for instance, in those days, the doctor knew what he was coming here to do when he came here in the morning or when he was called. And the nurses also knew, in coming to the hospital, this is my work, these are my limitations. These are what I was trained for. The pharmacist knew that these are my limitations, these are what I was trained for. Everybody had a knowledge of his or her space and work within that knowledge and of his or her space. But with time, for those, I don't know how it happened, people started to look at other people's spaces. The doctor, the nurse, the pharmacist, instead of confining yourself to your space. And I think it was done, it was caused mainly by administrators who now said, you are professional A, but you can also do what professional B is doing. So take a little bit of that. You can be this, you can be that. Everybody knew who could be this and that at that time, and they respected each other. But now everybody wants to take from professional A. I don't want to be specific. To professional A, take from professional B, and leave what you are supposed to do. Instead of confining yourself to what you are supposed to do, you want to take from X.
How that affected you here?
Of course, it's general. It's all over Nigeria. It has affected us.
How you want to manage
it? Because I'm also a part of the profession, but much more challenging that I'm an administrator and I need to balance the various professionals. So it's I try not to take sides. And whatever I do really, if I don't take time, I'm seen to take side. So what I've tried to do is to relate to all sides and talk and let us see reason.
How successful has that been?
Well, reasonably, it's been successful. It's challenging, like I said. There's always suspicion because I'm a medical doctor. So when I'm talking to non-doctors, there's always suspicion. But there has been a high level of understanding from the other professionals. Even at national level, I was involved in negotiation with the NMA. The one for JSUIT, I have not attended their meeting, but I'm in contact with their national, each time before it goes for meeting, we talk on the phone, and I appeal to him that please let us show some understanding on this issue, because ultimately, who suffers is the patient. For a second, a minute, a day, a week, a month of strike, you have deaths, and those deaths are not reversible. So the health professionals have to show understanding. Yes, you have issues, but I always believe that such issues can be negotiated and discussed. Things might be slow, but eventually we'll get there. And strike should be the last. They should be the last option in dealing, especially with issues that have to do with the health of our people. This is not because I'm a governor, but it's always what I have preached even before I came into government. I don't believe that we should just, for any reason, one policeman slapped a doctor at the gates of the hospital, and the doctors go on strike. I don't think that should be it.
Is there a backlog of some of these matters? Because you say some of these processes may be slow. Because we have someone who's asking, what's the fate of pharmacy students who graduated since 2011 without being inducted? Any such thing?
I'm not aware of it. I'll check.
Okay.
Do the major problem, if you ask many Nigerians, why people leave the country now for medical purposes abroad, is the issue of confidence. Do you also see that returning back into the sector? What have you been able to do to rebuild confidence in your citizens especially, and hopefully, see it spread around Nigeria?
But we're using this hospital as a model in building. I always say that one of the reasons why people go out is not just because of the expertise that is outside, but because I think like the CMD tried to talk about it, the attitude of our health workers. We've had stories, whether true or not, of an emergency coming to a hospital. The person is just on the couch there, and you go and call whoever is supposed to attend to, whether a doctor, a nurse, and all that. And maybe it's a lady, she's knitting one cloth or the other. Okay, I'm coming. Oh, okay. Who is that? Okay, what's the name? Why still knitting? Instead of getting up immediately, I'm going to attend to the patient. Of course, sometimes the story was that eventually it turned out to be the lady's husband. Who was there? That was when that kind of attitude. Here in this hospital, we've tried to bring some diaspora doctors. Of course, the attitude of the health personnel outside US or UK is slightly different. So they've not just brought their technical skills, they have also brought their attitude. And fortunately and happily, our own health personnel who are on ground, who were trained here and all that, there's been this marriage of knowledge between those ones and the ones here. And what we have also tried to do is to also send some of our personnel, the ones that were trained local and have been working here, outside for exposure for a few weeks or a few months. And that has helped, at least I know that in this hospital now, there's a significantly improved attitude compared to many hospitals in Nigeria. And for our other hospitals really is the problem of monitoring. we have an effective monitoring system. I have a health monitoring team, I have special assistants and